Good evening, everybody. My name is Margaret, and this is Team 2. This is Shanti, and she's Sowmya. We have a member missing, Roja, who completed her presentation last week. Most of you were not present, but our topic for today is liposuction, and she gave the introduction and the history last week. So we would continue our presentation today, starting with Shanti.
I'm going to explain procedure of liposuction. Excess skin and fatty tissues in different areas of the body leads to deformity in the shape of the body. So liposuction is a procedure that can help to sculpt the body by removing unwanted fat from specific areas, including the abdomen, hips, thighs, knees, upper arms, and neck. During the past decade, this liposuction was called as lipoplasty or suction lipectomy. Has benefited from several new refinements. Today, a number of new techniques, including ultrasound-assisted lipoplasty, the tumescent technique, and the superweight technique, are helping many plastic surgeons to provide selected patients with more precise results and quicker recovery times. Today, techniques are going to be explained by Margaret, and the candidates for liposuction would have normal weight with firm elastic skin who have pockets of excess fat in certain areas. The patient should be physically healthy and psychologically stable and realistic in their expectations. Patient age is not at all considered, but when compared to the results for older people, because older people usually have diminished elastic skin, so their results are not same as younger patients. Liposuction carries greater risk for individuals with medical problems such as diabetes, significant heart or lung diseases, poor blood circulation, or those who have recently had surgery near the area to be contoured. And the type of anesthesia used for liposuction. There are three types of anesthesia used for liposuction. The one is local anesthesia, the second one is regional anesthesia, and third one is general anesthesia. Local anesthesia is which numbs only the affected areas. The smaller parts are injected for this type of anesthesia, and the regional anesthesia is used for extensive procedures. This is normally the anesthesia used for regional parts are epidural block, which is commonly used for childbirth, and the last is general anesthesia. This is used for larger volume of fat is being removed, and the surgery procedure. The surgery depends on the size of the area to be lipoplasty. The amount of fat is being removed, and the type of anesthesia and the technique used. There are several liposuction techniques that can be used to improve the ease of procedure and enhance the outcome. Surgery is done through tiny incision. A narrow tube or a cannula is inserted and used to vacuum the fat layer that lies deep beneath the skin. The cannula is pushed and pulled out of the skin to vacuum fat layers which is deposited beneath the skin, and then the fat tissues are suctioned with the help of large syringes and vacuum pumps. Fluid is lost along with fat, and it's crucial that this fluid be replaced during the procedure to prevent the shock. And the next part is continued by Margaret.
Thank you. I'd like to discuss about the techniques involved in liposuction. There are several techniques. Some are being abandoned because of failures, and some are being used extensively by surgeons. The first technique is the tumescent liposuction, which tumescent means swollen or firm. The word itself shows us what this kind of technique is. In here, the affected area is injected with anesthesia. It's locally anesthetized, and when the area is swollen and firm, this fat, the excess fat, is removed using, incisions. Incisions are created, and metal probes are used to remove the excess fat. That lots and lots of blood is lost when liposuction is carried out. And an advantage in tummy-stent liposuction is that it provides local anesthesia, and it provides fluids to the body which occurs during the surgery. The next technique is dry or wet technique, which this technique has been abandoned by surgeons because there is excessive blood loss, and there is also a high death rate when surgeons had opted for dry or wet techniques. Dry technique is one wherein anesthesia is not used, and because of this there is excessive loss of blood, and it results in the death of the patient. Wet technique is wherein 15 to 20% of the local anesthesia is used, and yet it has a lot of blood loss. The next technique would be super wet technique, wherein it requires the injection of a volume of dilute local anesthesia, and this is greater than the tummy-stent technique but has a significant loss of the wet technique. Ultrasonic assisted liposuction, which is the next liposuction, has two sub-lipos in it. One is the internal ultrasonic and the external ultrasonic. Internal ultrasonic assisted liposuction is where a long metal probe, which may be solid or hollow, is inserted into fat through a large incision. It sounds scary, but yeah. External liposuction is wherein external liposuction causes burns because there is a metal paddle applied to the skin and directs ultrasonic energy into the fat. This causes burns to the skin, and it takes a lot of time to cure the burns. Next one is the power assisted techniques, wherein this power assisted techniques have been recently available, and here power is supplied using electric motor or compressed air to produce either a rapid in and out movement or a spinning rotation of an attached liposuction cannula. The surgeons are still skeptical about this technique, and it hasn't been approved as yet. The laser liposuction, which is widely used by surgeons, is one technique which helps decrease blood flow, which helps decrease destruction of the fat tissue and swelling. Usually in the traditional liposuction, there is no accuracy while the area is being contoured. So laser liposuctions are being widely used. If you could check a video. Did that look scary? All right. And the recovery for liposuction may not be clear until 6 months after surgery. Though the person will be able to walk immediately after surgery, getting back to routine work and lifting weights and the swelling to heal, etc., would take like 6 months or so. The advantages and the disadvantages would be continued by Sowmya.
And my part is about advantages and disadvantages. There are very few advantages when compared to disadvantages. The advantages are it provides physical and mental relief by removing excess fat in some areas in the body, increases the confidence level and removes mental stress created by others, looks better than earlier and gives physical appearance within the limits of technology and our body type. The disadvantages are liposuction pricing, fees and cost. It depends on many factors such as type of the technique you employ, number of areas suctioned and amount of fat removed. According to my knowledge, I feel that an ordinary person cannot employ this type of technique. Some doctors also prescribe additional post-operative care such as ultrasound and massage. Excess skin and need for a lift. Removing a large amount of fat at once may result in loose skin and stretch marks, etc., depending upon the type of the skin, depending upon the elasticity of the skin. Patients with stretch marks and older patients may have will end up with more loose skins when employed this technique. Counter irregularities, lumps, bumps, asymmetry, and irregular contours are most unwanted results of liposuction surgery. Infection after liposuction. Infections may result which are mild or severe. Doctors prescribe to take antibiotics to prevent infections. Signs for these infections are redness, vomitings, a high fever, chills, and red streaks visible on the skin. Swelling after liposuction. Swelling may occur for few weeks or months depending upon the type of the technique you employed and the elasticity of the skin, causing pressure on the nerves which results in the numbness and tingling. Burns from ultrasonic liposuction. When the patients employ this type of technique may result burns on the skin. One can reduce this risk by not operating too close to the skin. There are few more disadvantages such as organ damage to injury, pulmonary embolism, fluid imbalance, and even liposuction may result in death. There is a belief that one cannot gain weight if they are subjected to liposuction, but I feel that one can still gain weight if they cannot maintain proper diet and physical activities like exercise and so on. Any queries?
Thank you very much.
Is it cheaper than using a laser? Now the new method, is that cheaper than the older method?
You have a microphone.
I was just wondering if the new method was cheaper than the older method.
It all depends. If it's just a small area, then it would cost less, but laser is expensive compared to the previous techniques because it has a lot advantages compared to the previous traditional techniques. So it does cost high.
And it also depends upon the section part and how many times you are gonna get the treatment.
Each area you're gonna get your liposuction done, it would at least take 3 times treatment. 3 times, 3 doses or whatever. So,
Any other questions?
You said that there are many disadvantages than advantages. Then why you are going to implement this type of technology?
I just want to inform you that there are still disadvantages and better don't go for this type of technique. You may this may result in death.
Yeah, then why you are going to implement this type of
I just
technology?
want to inform you that
there are people who prefer looking good rather than, worrying about money or anything else. There are people who want to look good, want to be fit again, who are unable to lose fat. Is that it?
Other questions? Oh, okay. Now I had just a question about suppose that I have extra fat here, and you want to go equally, right, around the arm, so that you can't go halfway and stop, right? You have to go all the way, same thickness, so that, because you don't want to have something. No, you do ripple effect, right? So
That is the reason why in traditional techniques after liposuction you have to go through a surgery wherein they do they operate on the entire region to make it equal, to make to see that it doesn't sag, the skin doesn't sag and then look bad. But in laser technique, what the advantage is, while going through the liposuction itself, it even operates the underlying skin, which adjusts the entire look, and makes it even throughout.
how would you control or guarantee that it will just burn the fat, not the skin or deeper, or Just go.
I think the surgeons guarantee that.
Okay. Thank you very much.
You're welcome. Thank you.